Christy, you had the opportunity. You've traveled all over the world. You've witnessed what is going on in terms of health for women abroad, but you also had an eye-awakening experience right here in the good old U.S. of A. Tell us about what you found out about maternal mortality rates.
Yeah, so most people would imagine that the United States is number one or close to the top 10 in terms of safe motherhood. And yet, per the WHO, the World Health Organization, we are currently ranked 55th in the world. When I became a mom in 2003, we were ranked 41st. So we've fallen quite far behind in just, 18 years. In fact, the United States, which is only one of two industrialized countries that has a rising maternal mortality rate, which is pretty shocking given that
That
we
is
spend
shocking.
more per capita on healthcare than any other country in the world.
Tell us, why is the U.S. so behind other industrial countries when it comes to maternal health?
There are many factors. I would say our health system is not functioning as well as it should be. Black and brown moms are 4 times more likely to experience a complication or to die from a pregnancy or childbirth-related complication. Native American women are right behind them. That's shocking in and of itself, and it's not low-income moms necessarily. You could have a college-educated Black mother who may have a worse chance to survive childbirth than an uneducated white woman. And that's been getting the attention that it needs to be getting, I think, now, which can help us get hopefully beyond that into the root of the problem. We also have a lot of chronic health conditions, diabetes, hypertensive disorders, obesity. These are factors that can impact a pregnancy and actually exacerbate even a healthy pregnancy in the midst of a pregnancy. It's complicated.
It is, Dr. Ish, I mean, weren't you surprised to see this statistic? But at the same time, now that we hear why this is happening, we have to do better.
Well, we have to do better, and Christy so eloquently talked about those social determinants of health, right? We're not talking about anything extra. We're talking about the basics. Those social determinants of health determine 80% of a mom's outcome when it comes to these types of interactions, right? What are we talking about? Well, we're talking about access to safe housing, safe transportation, access to healthy foods. Obviously, a lot of that is income driven, but one of the bigger things that's driving it is the implicit bias from providers to the patients, and also the bias patients have that they're bringing to their doctor or their provider, thinking, what may they not know about me? How little might they care about me because I look so different? So she's did an eloquent job of describing that, and those are the things we really need to address. The pandemic did us a great favor because now we can do a lot of things virtually, but you can't check a cervix on Zoom. Right?
It's difficult. I haven't tried, but it would be a challenge.
Yes. Right? So all those things from 20 years ago come into play when it comes to moms, because you need to be in the office for that.
Right on.